Welcome to Better Than Ever Live, wherever you are, wherever you're watching, wherever you're listening. Hope you're making today your masterpiece. In today's show, we have a lot of good stuff to talk about today. We're going to talk about face yoga and how it potentially might make you look younger. We're going to talk about a technique that makes skin cells younger. We're going to talk about the link between what's called epigenetic age in your brain, how krill oil might improve your athletic recovery, pushing through pain during exercise, and how fast walking appears to slow the aging process. I'm Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Please understand, as always, on any of these live shows, any of my videos, on my website, I'm not giving you medical advice. This is meant for general information and educational purposes only. If you have comments, if you have questions about any of the topics we talk about today, please leave that in the chat, especially if you're on YouTube, because I cannot see the comments. Leave those in the chat. Facebook, LinkedIn, you do your own thing, which you normally do, and I will try to address those as we go. I'd love to know your first name and maybe where you're located. I always find that fascinating, especially so many overseas people that typically watch this, so I always like that. Remember, I don't answer medical questions on this show, Better Than Ever Live, but I do every Friday at 12 p.m. Eastern Time on Ask Dr. Geier Live. So if you have a muscle, tendon, ligament injury, arthritis, you're having an orthopedic surgery, you're trying to recover from one, and you have questions about it, again, I can't give you medical advice, but I can talk a lot about it and give you some things to think about. 12 p.m. Eastern on Friday, pretty much every Friday, so join me for that. The first study I want to talk about today regards the aging process, and you know I talk a lot about that. I'm fascinated by it. I'm getting a third board certification, or I'm working towards one in anti-aging and regenerative medicine, and so any studies about how to slow the aging process, reverse the aging process, something I'm going to be pretty interested in. Well, there's this study that just came out in Communication Biology is the name of the journal. It was a study done overseas in the UK, researchers at the University of Leicester. They looked at genetic data for over 400,000 adults in the UK, and they found a clear, very distinguished, very specific link between how fast you walk, your walking pace, and a genetic marker for biological age. What they looked at are the white blood cells, and specifically the telomeres and the length of the telomeres of these white blood cells. And we've talked about telomeres a little bit before, but they're an indicator of your biological age. What they found out is that if you walk on a regular basis, pretty much throughout your life at a brisk pace, we're not talking sprinting, just a brisk walk. Essentially, if you do that throughout your 20s, 30s, maybe your 40s, by the time you hit midlife, essentially you have the equivalent of being 16 years younger by biological age. Regardless of how much people exercised, a faster walking pace was associated with a longer telomere. Now again, we've talked about telomeres. Those are the caps at the ends of the chromosomes, and they hold sequences of non-coding DNA. They basically protect the chromosomes from damage. The analogy some people use is it's the plastic cap at the end of a shoelace that basically stops it from unraveling. Well, the telomeres basically protect the ends of the chromosome. And every time a cell divides, the telomeres get shorter and shorter to the point where there's no telomere anymore. The cell can't divide. The cell gets exposed to damage. They basically die. It's called senescence, which we've talked about as well. The longer your telomere is, that's a good marker for your biological age, regardless of how old you actually are, your chronological age. And what this study found is that people who normally walk slower walking speed, that's basically potentially an indicator for a higher risk of chronic disease, age-related diseases, unhealthy aging as you get older. So that may be something to think about now in terms, at least for physicians, at recommending interventions. So instead of just telling our patients, regardless of age, hey, you should go out for a walk every day. No. Maybe you tell them, hey, let's not just walk, but walk faster. So if you're going to walk from your car to the front door of your office building when you're going to work, and let's just say that's normally 500 steps and you typically do it in 2 minutes. I'm just making this number up. Now maybe you have them try to do it in a minute and a half. You just get them on a regular basis to walk faster to places they go. It seems to be associated with slower aging, significantly slower aging, 16-year lower biological age, and just by walking faster, regardless of how much you exercise. I think that is fascinating. All right, a study that I will talk about on TV here in Charleston, the 2 TV stations that I am the medical expert. I'm going to talk about this study next week, I think, in one of my weekday segments. I'm going to talk about this because it matters a lot to me in my world of orthopedics and orthopedic surgery and sports medicine, and that is pain with exercise. There was a new study that came out basically saying, hey, look, it's pain, I'm going to push through it. This was a study done in Orlando by the Jewett Orthopedic Institute, which interestingly, I trained at the Campbell Clinic, which is a world famous orthopedic training program in Memphis, Tennessee, of all places. It's been around forever, oldest training program in the country, tons and tons of presidents of the American Academy of Orthopedic Surgeons. Well, the Jewett Clinic is largely Campbell Clinic guys, but they went to Orlando. Maybe that's changed now, but that's how at least it used to be. But anyway, their sports medicine physicians surveyed about 2,000 people, and what they found is 18%, almost 1 out of every 5 people who performs exercise do it while experiencing pain during the exercise. On top of that, the same percentage, about 20%, regularly push through pain instead of resting, instead of going to see the doctor. Now, there's a lot of reasons that the researchers found as to why people were ignoring the pain. Largely, it was people not wanting to, well, some of it was not wanting to go to the doctor, but more importantly, it was people who didn't want to be told they needed surgery or didn't want to be told they weren't going to be able to exercise anymore. The problem with that is, unfortunately, you potentially make the pain worse, make the injury worse. And so I always tell people, I'm okay if you're having some soreness, you take a day off and let's see if it goes away. And if it does, fantastic. But at some point, you have to ask yourself the question, can I do what I want to do? Can I run as fast as I want? Can I play tennis as well as I want? Can I lift weights as well as I want? Or is pain keeping me from doing it as well as I want to do it? And if that's the case, it's worth getting it checked out. Yes, there are a lot of doctors, and I talk orthopedic surgeons too. I talk about this a lot, that have gone all in on, we're just going to operate on everybody. And some injuries need surgery. I'm not going to say that they don't. But good orthopedic surgeons, good sports medicine surgeons, sports medicine physicians try to get you better without surgery. And it doesn't have to be something that's potentially bad long-term like cortisone. There's a lot of treatments, especially coming out now, that are potentially less damaging long-term to try to help things heal faster. I've talked about them on these shows before, so maybe go back and watch some of my old Better Than Ever lives. But by pushing through pain, you very, very much risk making an injury much worse, making it much longer to go away, take much longer to go away, making it much more likely to need surgery, unfortunately. I was always amazed. About 1 time a day in clinic with one of my new patients, because I always ask people, so how long has this been going on? And at least once a day I'd get somebody that would say 6 months, a year, 2 years, and you're like, why in the world, you're thinking this, you don't say this to the patient, why would you not get it seen sooner than that? But so many people don't. That seems to be a real trick with sports injuries, exercise injuries, things like that. Sports is a little different, because if you get your leg taken out from you, you blow out your ACL, and you're really struggling to do anything, that's a little more clear cut. But this knee pain that just comes on while you're lifting weights, doing squats or leg presses or something, or maybe it's a pain radiating down the back of your leg when you run and you just keep doing it and goes on, and at some point you got to decide, all right, this isn't getting better, let's get it checked out. It's a little pet peeve of mine if you haven't told. All right, one of the things that I take on a regular basis as far as supplements is krill oil. I do it more for high blood pressure and high cholesterol prevention as much as anything, potentially lowering the risk of cardiovascular events and that kind of thing. But there is a new study published in the journal Nutrients that shows that krill oil supplementation might actually be beneficial for recovery from high-intensity training. The study involved 35 power training athletes. They got 2.5 grams a day of krill oil, which, to be fair, is a fair amount of krill oil. I take, let's see, mine is about 400 milligrams of EPA and DHA, which are omega-3 fatty acids. So this is 550, so it'd be basically 3 pills instead of 2. But krill oil also has choline, which just regular, like extra virgin olive oil, just has the omega-3 fatty acids and doesn't really have the choline. So anyway, they gave olive oil to one group of people, the controls or the placebos, and then krill oil to the other. 12 weeks. They measured omega-3 fatty acid index in the athlete's blood, plasma choline levels, and total antioxidant capacity, both before their exercise and after their exercise. And if you can guess what happened, and you can probably guess because I wouldn't be talking about this study if it didn't have a positive effect, the krill oil group, significant improvements in their omega-3 fatty acid index, significant improvements in their choline levels compared to placebo, and significantly better improvements in total antioxidant capacity after exercise compared to the placebo group. Omega-3s, choline, total antioxidant capacity, all measures of athletic recovery and athletic performance. So it seems that krill oil might be an effective means of better recovery from your training, better recovery from your sports, your high-intensity exercise. Now, like I said, krill oil's got a number of benefits, so there might be good reasons to take it other than athletic performance. Not medical advice, just saying that it's something you could talk to your doctor about, but that's a really exciting thing for those of you that like to exercise, really push yourself really hard. All right, we're going to talk a little bit more about aging, but this time we're going to talk about the brain. We're going to talk about epigenetic age and cognitive performance, basically memory and how well you can perform with your brain later in life. Study came in the journal Aging, and again, it's about the epigenetic age score. And I don't want to get too fancy on what this means. This is a big thing you're going to see in functional and integrative medical practices in the coming years. Our practice is thinking about doing epigenetic age tests, which is it's just a blood test, but it's looking for DNA methylation, which is a big fancy thing, but something that's another thing that's a big hot topic coming out. But it's looking at a lot of genes, what are called the epigenetic clock genes, genes related to immune function, genes related to adipocytokine signaling, things like leptin and adiponectin that are inflammatory markers. Adiponectin is good. It helps to decrease your fat levels. Leptin's potentially bad. Leptin increases fat storage and things like that. So it measures those. Lipid metabolism, inflammation, genes for all of that kind of stuff. It goes into a score that's called your epigenetic age. Then what you do is you compare it to your chronological age. So if you are 50 years old, but this test comes back that you have an epigenetic age of 60, that tells you you've got accelerated epigenetic aging. What you want is to be 50, but your epigenetic age is 40 or 35. You probably get the point. But let's just say you have accelerated epigenetic aging. Again, you're 50 and it says you're 60, or you're 35 and it says you're 45. That turns out in this study published in the journal Aging to be very predictive of a significant downturn in your brain's performance, your cognitive performance, 5 to 10 years later. So where this becomes interesting is this could become a screening tool for people at risk for dementia, people at risk for Alzheimer's disease, and allow physicians to do some treatments and intervene earlier. The problem with Alzheimer's, the problem with dementia is that by the time the diagnosis isn't made till the patient has symptoms. And by that point, all the degeneration in the brain, it's already started to happen. You can't reverse it. So by knowing the epigenetic age, maybe doing cognitive function tests and questionnaires, maybe MRIs, that kind of thing, so that you reveal issues with cognitive decline before you get significant neurodegeneration, you might be able to intervene and potentially make some changes. So that may be something that you think about, getting epigenetic age tests in the coming years. I think this is going to be something that's really, really popular. But why do we care about aging in terms of living longer or our brain's performance? That's not what most people care about, right? No. Most people want to look younger. I'm not going to fault people for that. I think that that's great. Well, researchers in the UK have found a way, And I'm not going to get into the nuts and bolts of it. I tried to understand it, and even I was struggling with this. But they found a way to reverse the aging process in skin cells, basically making skin cells 30 years younger. The method is called maturation phase transient reprogramming. Again, they published their results in this journal, eLife, a couple weeks ago. What they did is they took fibroblasts, which are a type of skin cell. They took them from 3 middle-aged donors about age 50 or so, and then compared those fibroblast cells to cells from donors that were between the ages of 20 and 22. And what they found is the middle-aged cells were similar to the younger cells chemically and genetically, but when they did this maturation phase, technique, the skin cells all of a sudden became identical to the skin cells, the fibroblast cells of the 20-year-olds chemically and genetically. They were even able to they even had genes that allowed them to fight off age-related diseases, Alzheimer's, cataracts, that kind of thing. But more than that, it wasn't just that they looked young and had genes similar to younger skin cells. They then injured the skin cells, basically created a wound to see if it healed. We know young people's skin heals pretty much anything really well. Older people's skin didn't. No. Once they did this technique and made the skin cells basically 30 years younger, like 20-year-olds, they healed just the same way as the younger cells. The reprogramming of these cells, because it's only partially reprogramming as opposed to other techniques that are complete reprogramming. Anyway, these cells, it's a technique that takes 13 days, and they still retain their identity, meaning they're still skin cells. They don't become other types of cells. Makes them biologically younger, makes them functional, they function as if they're younger. Now, one of the theoretical problems with the cellular reprogramming, and this has been more of a theoretical concern than something that's been proven, is that yes, they could become cancerous. That's something we don't know. These are cellular studies. These aren't done in humans or even done in animals. So we're gonna need to see these researchers prove that you can restore the function of younger skin cells and hopefully look younger. But this is essentially proof of concept. Now we need to do these studies, reprogramming cells inside a living person, find out and it would be animals first, but then find out what risks come with that. It is amazing. That isn't something to act on. That's years away, I would imagine. But can you imagine? You go to the office, you get some kind of procedure, 3 weeks later, your skin looks 30 years younger. That's just fascinating. We're within the next 5-10 years, we're going to have dramatic ability to fight the aging process, maybe reverse the aging process. Not just physical appearance, but in terms of all sorts of chemicals, organ systems, and all sorts of other things, genetics and everything else. All right, the last one I want to talk about is, we're going to talk, so Ibrahim says it, face yoga. Does it affect the collagen? It's funny, I'm going to talk about it. Let's talk about this, and maybe, just maybe, I will try to demonstrate it, even though I meant to find like a YouTube tutorial on how to do this to make sure I was doing it right, and then I didn't do it. So do not use what I'm going to, if I show it, as how to do it. You can find people online that teach this. But let's talk about, does face yoga make you look younger? All right, so everybody works out, lifts weights, everything else to build their muscles throughout their body and look young. Can you do the same thing? Build the muscles of your face to look younger. A lot of people hold tension in their faces, and there's terms for that. You can call it whatever you want. But the thought is facial yoga can alleviate some of that tension. Now, the theories behind face yoga is that these exercises give you a more sculpted look of the muscles around your face, maybe a slimmer look to the muscles around your face. Your muscles will relax. You'll appear younger. You will appear happier. So this was a 5-month study done at Northwestern. This isn't some sort of crackpot place. 5-month study. They basically had people do 30 minutes a day or every other day every day, I think it was 5 or 6 days a week, or there was an alternate day where you did it every other day. 30 minutes a day of these facial exercises, and what they found, this was in middle-aged women, looked younger. They had fuller upper and lower cheeks, and it made them look 3 years younger. And again, they did it over 5 months. But what was interesting is that you could see benefits in just 2 to 3 weeks. What they found is the facial yoga exercise increased their blood circulation to the tissues of the face. Definitely good. Gets rid of free radicals, brings healthy nutrients to help everything heal. And what they found, it was really easy. People could do it at home, no exercise, nothing. And so what the program involves, at least the way Northwestern's did it, is everybody did 32 exercises. They had to hold each one for about a minute. Now, one of the ones I will not show you is called the cheek lifter. And again, there's 32 exercises. So go find YouTube, or I'm sure you can Google face yoga. There'll be people to show you to do it. Even though it'd be funny if people actually charge for that. Like you charge for your personal trainer, you charge your face trainers charge you for face yoga. That would be funny. But anyway, there's one, the cheek lifter. You open your mouth, you form an O, put your upper lip over your teeth. You smile really wide so that your cheek muscles go up. Then you put your fingers on the top part of your cheek, pull them up, then you release, and then back up, and you do that for a minute, working these upper cheek muscles. Repeat. Lift, repeat, lower. Another one they call happy cheeks. You smile without showing your teeth, and you purse your lips together, so it'd be sort of like, and then you smile to force your cheek muscles up, like that, I guess. I'm sure I look ridiculous. Then you place the fingers in the upper corners of your mouth, and you basically slide it to the top part of your cheeks. You're holding it as high as you can, 20 seconds, then you release, and then you do that again. And again, these 32 exercises, and I'm sure there's shorter ways to do it, 2 to 3 weeks they saw benefits. By 5 months, the people looked 3 years younger. Now, I told you, one of the things that it did is that it increased blood flow to the tissues. The other thing that they found that it did, and we know I talk about stress producing cortisol, and cortisol has got a number of damaging effects on the skin. What they found is the people that did these yoga exercises, it decreased the stress, it decreased cortisol. So including building all the facial muscles, delivering blood flow to your face, it may also help your cortisol levels by lowering your stress. Now, the problem that they found, and I can see this being a problem, because I was like, I would do something, watching TV before I go to bed or something. The problem is at least in this study, you're talking 6 to 7 days a week, 20 to 30 minutes every day. That's a lot to ask. Now, what I would wonder, and it's just like any workout, so many workouts they've found that, yes, you can work out for an hour straight, but you can also break that up into 2 30-minute chunks and do just as well, or 3 20-minute chunks. I wonder if this is something you could do for a few minutes here, a few minutes, a few hours later, a few minutes, and get through all your exercise throughout the day, but not do it sitting down for 30 straight minutes. I could see that potentially being a problem. And Ibrahim, I don't know if it affects the collagen per se, at least in this study. But if you think about what you're doing when you lift weights, for instance, you're creating these microscopic tears in the muscle, then your body heals that. I've talked about how peptides help muscles heal, both to treat injuries or just peptides that are naturally made in your body. But yes, in theory, that acts on the collagen pathway. So even though they didn't test for collagen, I do suspect face yoga does have an improvement in collagen. Would it help you avoid Restylane or some of the collagen fillers? I don't know. I would love, maybe I'll do this as a recorded video where I'll do it for a few weeks and record videos of me doing it and before and after pictures and stuff like that, because I'm really curious. I just need to find a credible program where I can watch along and see how they do it and all that kind of good stuff. If you have comments about any of those topics, especially the facial yoga, feel free to post those in the chat. Otherwise, we're going to wrap up. One thing, and I talked a little bit about some of the stuff I do aging-wise and sports medicine-wise and things like that. If you would like to come see me in Charleston, South Carolina, I have patients that come from all over. I can work with you on that. There's a link to my website in the description. It'll take you, drdavidgeier.com. It'll take you to my contact page where you can just fill out this little 3-4 question thing that basically gets to me and my assistant, and we can help you set up an appointment if you'd like to do that. If you can't come to Charleston, there's some ways we could work together, sort of more of a health coaching type of thing, so contact me that same way as well. If you like this type of information about optimal health and wellness, all that kind of stuff, make sure to subscribe to my podcast, especially if you can't be here live. Better Than Ever Live, wherever you get your podcasts. You'll miss the fantastic facial expressions like today, but definitely subscribe. You can listen to it on the way to work, on the way home from work, at the gym, all kinds of good stuff. Also, if you like videos like this, information about health, wellness, healing, recovery, make sure to subscribe to my channel. The links to all my social media is below so that hopefully you can feel or perform your best regardless of age, injury, or medical history. That is all I've got for you today, Ibrahim, and I hope I'm saying that right. You are so welcome, and I am very happy that you benefit from this channel. If anybody knows people that like health and wellness, aging, literally I had patients today asking me about MNM that we've talked about on this show. We were talking about all sorts of peptides. We were talking about all sorts of ways to burn visceral fat with exercise and all kinds of good stuff. If you like that stuff, let people know, or if you know people that like that, let people know, because I love sharing this information. I don't think many people in the medical world, I think they're too focused on, this is the disease, I'm going to fix it right now, just treat the symptoms, then it pops back up. I think it was David Sinclair who wrote Lifespan that used the analogy of whack-a-mole medicine. That's basically what most medicine is here in the United States. Just this problem pops up, let's treat it. This problem pops up, let's treat it, instead of trying overall to get people healthier. So I'm really interested in that. All right, that is all I've got for you today. I am extremely, extremely happy that you joined us. Please join us Thursday. We got another great show. And if you have medical or orthopedic questions, join us Friday, 12 p.m. Eastern Time. Thank you so much for watching, and I will see you